Hey there, and welcome to this explainer. Look, if you're watching this right now, chances are you are just completely exhausted. You might be spending your entire day trying to argue facts with someone whose brain is, well, actively rewriting them. It is incredibly tough. But today we're going to transform that deeply frustrating goal of correcting dementia behaviors into an absolute lifeline. We're going to dive into the compassionate, scientifically backed approach of connecting with your loved one's emotional reality.
Here is our roadmap for today. First, we'll decode those confusing dementia behaviors. Then we'll cover the compassionate paradigm shift, dig into some practical tools for connection, talk about making the home safe, and finally, focus on supporting the caregiver. Let's just dive right in.
Section 1. Decoding confusing dementia behaviors. We really need to start by acknowledging one of the absolute hardest parts of this journey, and that's the bizarre, unpredictable, and honestly, deeply distressing behaviors you're probably witnessing on a daily basis. I mean, consider this scenario. Why is Dad talking to a photograph? When you see a loved one trying to feed a picture or having a full-blown conversation with a TV character, it's completely natural to feel exhausted or even to think they're just being difficult. But there's actually a fascinating neurobiological reason behind this. Their brain is essentially turning into a time machine.
Science shows us that these are not deliberate acts of defiance. Take what's called the picture sign, treating photos as real people. This happens because atrophy in the right frontal lobe literally impairs their visual filter, making flat images look three-dimensional to them. And that time shifting, that's actually Rebott's law in action, where recent memories fade away but distant ones remain crystal clear. So they might be cognitively living in a totally earlier era, driven by deep primal nurturing instincts from the amygdala, which actually stays largely intact. They aren't being stubborn. Their brain is just working with a really fragmented reality.
So the absolute most crucial takeaway here is this. Behavior is communication. When they confabulate or make things up, they aren't lying. It's simply the brain's desperate attempt to express an unmet need through the only reality they have left. Instead of seeing these moments as symptoms we need to suppress, we have to start looking for the message hidden underneath.
Which brings us to Section 2, the compassionate paradigm shift. Understanding that brain science naturally leads us to a massive pivot in how we provide care. In the past, clinical care relied super heavily on reality orientation. This basically meant constantly forcing objective, physical, and temporal facts onto the patient. But I want you to imagine being told your spouse died every single day. That is exactly what reality orientation does in the moderate to late stages. It just causes catastrophic distress and fresh grief over and over again. Instead, we have to shift to validation therapy, which was developed by gerontologist Naomi Feil. Validation therapy prioritizes the emotional truth. It prevents escalation, restores their dignity, and honestly fosters a lot of peace.
So when a delusional episode hits, here is your actionable 4-step game plan. First, center yourself. Take a deep breath to suppress your own natural instinct to correct them. Second, acknowledge their emotion by matching their tone and intensity. Third, gently rephrase and reminisce. You want to reflect the feelings behind their words rather than focusing on the cold, hard facts. And step 4, never ever quiz them. Step gently into their chronological reality rather than dragging them painfully into yours.
Expanding on validation, we have habilitation therapy, pioneered by Paul Raya. Now, this isn't about trying to get lost cognitive skills back, because unfortunately, that's a battle we just can't win. Instead, it's about creating a holistic, prosthetic environment. Think of it like a physical space designed to do the thinking for them, which helps sustain positive emotions throughout the whole day. By modifying the space and our own behavior, we actually lower their resistance to care and can dramatically reduce the need for medications.
If you take absolutely nothing else away from this explainer, please remember this. Meet them in their reality. Connect, don't correct. When someone's reality is fundamentally altered by neurodegeneration, the kindest, safest, and most scientifically effective intervention you can offer is simply joining them there.
All right, moving on to Section 3, practical tools for connection.
We've talked a lot about the philosophy, so let's build out your daily toolkit with some specific non-pharmacological interventions. First up is reminiscence through photos. You'll want to organize large, labeled photo albums chronologically with a super simple design. We're talking just 1 or 2 photos per page. Revisit these frequently to help reduce isolation. But remember our rule, no quizzing. The goal here is not to test them on names. The goal is to ask open-ended questions about how they felt in that moment. This removes all the anxiety of having to remember facts and allows for pure, genuine emotional connection.
Next up is something that might sound a little surprising at first, Reborn Doll Therapy. Providing a highly lifelike baby doll actually activates those deeply ingrained nurturing instincts we talked about earlier. It taps into a part of the brain that remains really highly active, giving them a profound emotional anchor. This directly soothes agitation, reduces pacing, and remarkably, it decreases the need for heavy sedating psychotropic medications.
Now, if you're going to try this, especially for late-stage care or in nursing homes, the specific features of the doll actually matter a lot. You want to look for an 18-inch size, which tends to be the most versatile for the elderly to handle. Ensure the doll has a realistic infant weight, somewhere between 1.2 and 2.5 kilograms, or about 2.5 to 5.5 pounds, because that weight stimulates deep pressure and calmness. And definitely stick to materials like platinum silicone or soft cloth bodies that have wipeable, non-porous surfaces, just to keep hygiene strictly under control.
Beyond physical objects, having a predictable daily routine is basically a cognitive wheelchair. It is a totally free, powerful tool that acts as an anchor in a very confusing world. Structure the day with a fixed wake and wash time. Keep meals and medications super consistent. Schedule any high-energy activities for their best hours, and fiercely protect the late afternoon with a calm wind down. This is crucial for preventing that late-day surge of confusion known as sundowning.
Next is Section 4, Making the Home Safe. As judgment and spatial awareness start to fade, we really have to zoom out and look at the physical environment. I know it's incredibly tough to take away someone's independence, but we have to mitigate high-risk hazards so they can age in place safely. Clear out those loose rugs and drastically improve the lighting to prevent falls. Add grab bars in the bathrooms. Use stove knob covers or auto shut-off devices in the kitchen. Lock away all cleaning products, tools, and firearms. And, this is a big one, lower that water heater temperature to prevent accidental scald burns.
Wandering is another massive risk, and it's often driven by an unmet need or just general restlessness. To prevent dangerous situations, install locks high up on doors or completely out of their usual line of sight. Use door alarms or simple chimes so you can hear if an exterior door opens, and make sure to enroll them in a safe return program with an ID bracelet. Also, please have that incredibly difficult conversation to remove access to their car keys early on, way before a crisis forces your hand.
Okay, let's talk about medications. Missed or doubled doses are just incredibly dangerous, especially since dementia is usually layered on top of a bunch of other chronic conditions. You need to create one concrete master list of all pills and dosages, group them by the time of day, and log every single dose immediately after it's taken. The golden rule here is simple, but vital. Never, ever rely on your memory or anyone else's to manage complex prescriptions.
Finally, Section 5, Supporting the Caregiver. Yes, that means you.
Before you just assume a sudden behavioral spike is simply the dementia getting worse, you absolutely have to check for hidden physical pain. Often they literally lose the vocabulary to say, "my stomach hurts" or "my tooth aches," so they end up lashing out instead. You can use objective tools like the Pain Ad scale to measure things like breathing, vocalization, and body language. Assessments like Behave Ad actually show a very strong link between severe pain and increased aggression. So checking for unmet needs like hunger, thirst, or even hidden infections first is going to save you an immense amount of frustration.
We also have to talk about you. The emotional heavy lifting of this work is just staggering. Caregiver burnout is real, it is serious, and it is preventable. This journey introduces what psychologists call ambiguous grief, which is basically mourning the loss of someone who is still physically sitting right across the table from you. Acknowledging that complex, really messy pain is step one of realistic self-care.
You literally cannot do this alone. Consistency is care, so you must systematically share the logistical burden with siblings, other family members, and paid aides. Ensure that routines are strictly consistent across everyone involved. Lean on digital family coordination tools, like the Carelo app, to sync medication logs and share notes. And please, schedule regular respite care breaks. Remember, respite care is not a luxury, it is an absolute medical necessity for your own survival.
So I'll leave you with this final thought. Are you ready to stop correcting and start connecting? Because when we finally stop fighting to pull them back into our reality, we might just realize how much joy is waiting for us in theirs. What if their world is exactly where you both need to be right now? Thank you so much for joining me for this explainer, and please take care of yourselves out there.